Do you feel overwhelmed in trying to figure out the differences of your Medicare costs and coverage? Medicare can seem complex, but it doesn't have to be. Understanding each part of Medicare clearly can help you with choosing the best plan based on your needs and budget. Hi, my name is Edwin Rodriguez, your health insurance representative. On this channel, we discuss health insurance with a focus specifically on Medicare and ACA plans. Since 2007, I've had the pleasure of working with individuals and families regarding their health insurance. And the best part is my help to you is completely free. The federal government actually standardizes broker and agent compensation, ensuring that conversations are free from bias. In today's video, we're going to cover the 4 parts of Medicare. Medicare's Part A, B, C, and D, the costs related to each of those parts, as well as the coverage in basic terms of how those plans or benefits treat you. And if you stick around to the end of the video, I'll share with you a few common misconceptions people have regarding Medicare and their coverage. You won't want to miss. So the first part of your Medicare is Medicare Part A. This is also known as inpatient care. This is hospitalization coverage. Think of this as anything where you're admitted 24 hours or more. So examples of this would be inpatient hospitalization, skilled nursing facility, hospice care, all fall under the Part A portion of your Medicare. Now, the cost of your Medicare Part A is generally going to be free. As long as you work 10 years in the United States, your Medicare Part A is going to be offered to you at no cost. And when you turn 65, you're automatically going to receive your Medicare Part A in the mail. If you're also drawing Social Security before turning 65, you'll also receive your Part B in the mail. More on Part B later. So what we're talking about are the basics of your Medicare. This is assuming for the parts A and B portion of this conversation, this is assuming you have only Medicare card. So that red, white, and blue card, if that's all you have in your wallet, this is what this conversation is pertaining today as far as the cost and coverage of the traditional Part A and B of your Medicare. So Part A covers you for hospitalizations, inpatient care. In the event of a hospitalization with Medicare only, Medicare Part A, it's going to cover you for a $1,676 deductible. Now, that's whether you're there 1 day, 2 days, 10 days, 60 days. Medicare is going to cover your entire bill minus a deductible of $1,676. Now, that deductible is every time you get hospitalized outside of a 60-day window. So, for example, you get hospitalized on January 1st, you leave, you come back, and you get readmitted back to the hospital, you are paying that deductible again. But if you return within 60 days, for example, you go back to the hospital, you're not having to repay that deductible again. If you're in the hospital for more than 60 consecutive days, then there is an additional copayment per day after the first 60 days. Now, most folks don't stay with traditional Medicare, so we won't go into too much details as far as those additional costs. Just understand that there is a standard deductible in the event of hospitalization with straight Medicare. Skilled nursing facility is also covered under the Part A of your Medicare. In the event of skilled nursing facility with, again, traditional Medicare, your first 20 days are covered at no cost. If you're there past 20 days, days 21 through 100, there's an additional $209.50 copayment per day for every day that you're in the skilled nursing facility from days 21 through 100. If you're there past 100 days, hopefully never, but if you're there past 100 days, then there's actually no coverage with standard Medicare past day 100. Something to keep note of. Now, the Part B of your Medicare is for outpatient care. This is anything outside of the hospital, okay? Think of this as pretty much everything other than being admitted in the hospital, right? Doctors, labs, surgeries, outpatient surgeries, emergency room visits, MRIs, CAT scans, labs, follow-up visits, traditional preventive care is what's covered under your Part B of your Medicare. So the cost of your Medicare Part B generally starts right around $185 per month. Now, that is the standard cost of your Medicare. If you earn less than $106,000 per year as an individual filing single or married filing single, and your income is less than $106,000 per year, then your Medicare Part B premium would be $185 per month in 2025. If you're married filing joint, that income amount could be as high as $212 per year. And in 2025, if you're married filing joint with your spouse, then that income amount can be as much as $212,000 per year. If your income is higher than those thresholds, you'll have an additional penalty that you'll be charged on a monthly basis for having excess income is what is considered through Medicare. And that is an increase to your Medicare premium and your drug plan premium. And essentially, it's just the way of the government saying, hey, you made more money. So if you're above those thresholds, then you may see an additional premium in addition to that $185 per month for your Medicare premium. Now, if you were making that higher income in prior years, but now your income has decreased because you're retired, maybe you're not working for corporate America anymore, or Fortune 500 company, or you're no longer self-employed, whatever your situation was, and your income is now going to be decreasing, there's actually a form you can fill out called Form 44B. We'll include that in the description below. And with that form, what you can do is fill that out. It's a very simple 2-page form, and it just tells Medicare and Social Security that, hey, yes, I was making that money in the past, but now I'm expecting to make X amount of dollars moving forward. And again, if your new income amount is below those thresholds, then they'll be able to readjust your Medicare premium down below that 180 or back down to 185 per month. Now, if you're going to be drawing Social Security once you start Medicare, that Medicare premium will automatically come out of your Social Security check starting the month that your Medicare begins. If you're not drawing Social Security, Medicare would generally bill you on a quarterly basis for that Medicare premium. Some folks don't like seeing that premium come in as on a quarterly amount. So you can actually go to Medicare.gov. Here's a pro tip for you. You can go to Medicare.gov and change your frequency of payment from quarterly to monthly if you're manually paying for your Medicare on a monthly basis. Now, again, assuming you're with straight Medicare, the Medicare Part B portion of your coverage, again, is for outpatient care. This is anything outside of the hospital, doctors, labs, outpatient surgeries, emergency room visits, imaging, labs, preventive care, so on and so forth. Anything outside of the hospital where you're not being admitted is going to be covered under the Part B, as in Bravo, portion of your Medicare. In the event that you have only your Medicare card, so that red, white, and blue card, in the event that you only have straight Medicare, there's a deductible in 2025 of $257. So that $257 has to be paid first before Medicare is going to help you with your expenses in an outpatient setting. Now, that is an annual deductible. This Part B deductible is once per year of $257. Once that deductible is met, then Medicare is going to cover 80% of your health care, and you're going to be responsible for your differences of 20%. 20% of what? You don't really know. And that's why we suggest other options in addition to your regular Medicare. We'll have another video we'll include in the description below, giving more details comparing your options, primarily with Medicare Advantage plans, also known as Part C, we'll discuss in just a moment, versus Medicare supplement plans. And those are really your two main categories of coverage when it comes to Medicare. Again, we'll link that in the description below so you can reference that video. Very informative, helping you understand the differences between those plans. Now, if you go with traditional Medicare, if you choose to go with traditional Medicare A and B and decide you want to enroll into a supplemental plan, then you're going to actually have to buy the drug coverage separately. That's the Part D. So we're going to skip over Part C for just a moment, come right back to it. So far, we have your Medicare A and B. That's your hospitalization and medical coverage. And if you decide to stick with straight Medicare, you add a supplement policy in addition to it to help you with those Medicare costs. Again, the other video related to Medicare versus Advantage plans will give you more of an in-depth feel and understanding of those differences and helping you pick which plan is best for you. But if you do go the standard Medicare route with A and the B, you add the drug coverage separately. That's also known as Part D, as in drugs. Okay. When it comes to Medicare Part D, that is offered to you from private insurance companies. With these plans, they're required to cover a minimum standard of coverage related to pharmacy benefits. So they're all required to cover all classifications of medications, not every medication, but all classifications of medications. Now, with these plans, again, they are offered from private insurance companies, and you do pay a premium for your drug plan. Again, assuming you go with Medicare A, B, and you add a supplement, you'll have to add the drug card separately if you go that route. In doing so, you're going to want to shop a drug plan specific based on your individual needs. So this is going to come down to your medication. So the names of the medications, the dosage, the frequency of these medications, the preferred pharmacies that you have will all be a compass in helping us shop the plan and makes the most sense based on your individual needs. Something new for 2025 is a cap on prescription drugs. It's a catastrophic coverage for medications. In the past, there was a limit as far as the insurance company willing to spend at the pharmacy. Then you fall into a term called the donut hole. You might have heard of that. No longer a thing. Starting in 2025, insurance companies are now required to cap your out of pocket expenses of $2,000 per year. So, in the event you have a catastrophic year, you're spending a lot of money on medications at the pharmacy, and your expenses ever reach $2,000, then once your out of pocket expenses reach $2,000, your hands are washed for the calendar year, meaning no more out-of-pocket expenses for your medications, okay? So what goes towards that medication limit of $2,000 is going to be any deductibles you have associated with your plan, any co-payments that you pay for your medications, as well as any co-insurance percentage that you pay towards your medications. Okay. Everything that you spend at the pharmacy goes towards that $2,000 cap in the calendar year, everything except for your premium for obvious reasons. One thing to keep in mind as well is prescription drug plans use what we call a formulary, which is a list of how medications are covered. So again, when we're shopping drug plans, we'll do our due diligence and making sure that we're finding the most cost-effective plan based on your specific needs. What we do is we enter in your medications, preferred pharmacy, we hit run, and then it actually brings the cream to the top. We can actually filter out based on total cost. That's monthly premium as well as your prescription cost all in one spot. It'll take your medication cost plus your premium, and it'll give you an annualized amount, and it will show you which plan is going to be the most cost effective for the year based on your specific situation. Now, jumping back to the Part C of Medicare, it's called Medicare Advantage plans. It's really not tied directly to Medicare. So it's kind of confusing when you say Part A, B, that's Medicare, C, D, those are private insurance plans. So again, the A, the B is your standard medical coverage. The D is your drug coverage. Okay. Now, if you go that route, you want to go with a supplement plan on top of that to help you with your medical expenses. Now, some people decide that they don't want to go that route. If that's your situation, you don't want to go the supplement route, maybe because of budget reasons, or maybe that's just not the best plan for your needs. You have what we call a Medicare Advantage plan, also known as Part C. Medicare Advantage plans are offered to you from private insurance companies. Medicare Advantage plans are also standardized, meaning that these plans are required to give a minimum level of coverage that's going to be required to be just as good as traditional Medicare or more. When I say or more, there's some additional benefits that Advantage plans include that traditional Medicare does not. For example, discounts on dental, vision, hearing, gym membership. Most Advantage plans also include prescription drug plans, so you don't actually have to buy a separate Part D. Essentially, this is the map of the federal government. The cost of Advantage plans can vary widely from market to market, state to state, even from zip code to zip code. Now, here in Florida, where I'm located, Central Florida, most of these plans are offered at zero premium. So there's actually no additional cost other than your Medicare premium. Again, that standard $185 per month, regardless of what option you go with, whether it's standard Medicare, a supplement, or in this case, an Advantage plan. Regardless of what option you go with, the Medicare premium, $185 is your standard Medicare premium. With most of these Advantage plans, there's actually no additional cost on most of these plans. So you're not paying an additional premium for your medical or your drug plan with an Advantage plan. It's offered to you at no cost. Now, often my clients will ask, well, how can they offer me health insurance at no cost, right? So the catch to these Advantage plans is that you use doctors and networks. So you want to make sure the doctors that are important to you are participating with your plan. That's where my team and I will come in and help you shop plans based on your specific needs, help you shop plans based on your doctors and medications. With these plans, there are also out-of-pocket costs. So in the event of this, you pay that. For example, one of my more popular plans here in Central Florida, maybe it's 0 for primary care doctor visits, 30 for specialists. With these Advantage plans, they generally have fixed costs associated with it with little to no deductible. So you're not having to come out of pocket tens of thousands of dollars before these plans kick in. Day one, right away, you're going to be covered in the event of hospitalization, surgeries, labs, emergency room visits, traditional doctor's visits. You're going to be covered day one with generally a flat co-payment or sometimes a small co-insurance. Now, these plans, because you do have out of pocket, you have a safety net, what we call a maximum out of pocket, which is a guarantee to make sure you're never going to have to file bankruptcy for medical expenses. You're going to be capped as far as how much you would have out of pocket in the calendar year for hospital and medical services. Okay. Now, these limits are separate from the drug portion of coverage, and these out-of-pocket limits are separate from your drug coverage. So again, with the Part D, you have that $2,000 safety net. With Advantage plans, Part C, you'll have a maximum out of pocket. Again, depending on the plan, that can be as low as $1,000 for your max out of pocket, and you'd be as high as maybe $7,000 for that max out of pocket. Now, as promised, I wanted to give you a few common misconceptions that people have about Medicare. One of the most common questions I receive from my clients is, Edwin, does my plan cover long-term care? The answer is no. Medicare does not cover long-term care. Therefore, these other plans do not cover long-term care, like your supplement or Advantage plans. They do not cover long-term care. Now, if you require home health care, post-hospitalization, post-surgery, that is something that's covered. but that's limited to nursing duties like rewrapping wounds and helping administer medication and making sure you're cleaned off. But that's not going to be additional care for like respite care, janitorial duties for someone to come clean your house, cook your meals. And it's not going to be for entertainment purposes either, where someone comes in and helps you set up your Wi-Fi or plays card games with you, right? The home health care is again limited to medical care only in the household. That is something covered. But long-term care for long-term aspect of taking care of mom, dad, or yourself, it's something that is separate insurance you'd want to buy more so in your 50s or 60s. That's the best time really to buy long-term care. That is separate insurance, separate coverage. So please keep that in mind when preparing for your Medicare and your long-term care. That is separate coverage. Medicare does not cover long-term care. Another misconception that some people have is that they're allowed to have a supplement and an advantage plan. So they think they can get all the bells and whistles with an advantage plan and keep a supplement. Well, big old no, you can't do that. Generally speaking, whenever you go with a supplement, you have to add drug coverage for Part D for your drug plan. Okay. Now, if you don't want to go that route, then your alternative option is going to be an advantage plan where it's the medical and the drug together. You do not tie your supplement and an advantage plan together. Those are separate coverages, separate policies. You have to choose between one or the other. And finally, the last misconception people have is insurance pays for everything. No, it doesn't. Does not pay for everything. There's always going to be some type of out of pocket, some type of expenses when it comes to health insurance. Okay. Whether it's standalone, traditional insurance plans, like from group insurance during working days, marketplace plans to the Affordable Care Act, or in this case, Advantage plans, Part C, there's always going to be some type of out of pocket expenses, right? So keep that in mind. So to recap today, we've discussed the four major parts of Medicare. Medicare Part A, which is your inpatient hospitalization care. Medicare Part B, which is your medical care. Medicare Part C, which is your advantage plans. That's the medical and the drug tied into one policy. And finally, Part D, as in drugs, for your pharmacy benefit or prescriptions. If you found this information helpful today, do us a favor and like, comment, subscribe. Your support means the world to us, and it tells us that we're doing a great job delivering this content and keeping you informed and up to date. Now, the Medicare landscape is always changing on a year-to-year basis. So to stay up to date with changes related to Medicare, we recommend subscribing to the channel to stay up to date on Medicare information as it changes year in and year out. If you found this video helpful and we've answered your questions and you already know what you want to do, there's a link in the description below that will be titled Enroll in a Plan. By doing so, that helps support us in this channel as well as yourself in enrolling into a plan on the self-service link. You can actually go through the steps of either enrolling into a supplemental plan, standard drug plan, or even an advantage plan. If you already know what you want, you can go to that link, enter your zip code, and follow the steps on getting set up with a plan. Obviously, if you require some assistance, my team and I are here to help. Feel free to give us a call or schedule a call with us using the link below under schedule a call. And my teammates and I will be more than happy to assist you in guiding you through and answering any additional questions you may have regarding your Medicare. Again, our goal is to be a long-term resource for our clients. When you think insurance, think Insurep. If you found this information helpful, consider watching this video here for additional information regarding your Medicare journey. We'll see you on the other side.